Welcome to our second webinar in our series. Let me get 1 second to get a recording going so that way we can watch this later. It already is recording. Perfect. All right. If y'all want to go ahead and while we're getting started, go ahead and enter into the chat. Let us know where you're from. We'd love to hear. And we're actually also going to start with a couple quick poll questions. So let's go ahead and get those launched. Take a second to look over those and put in your answer. And it's all right if you don't know some of the answers because we're going to be going over all of these things. Take a few more seconds to go ahead and type in where you're from, and we'll get started here in a few seconds.
Looks like we have just about everyone participating in the poll. So thank you. And if you haven't participated in the poll, throw your answer in there and we'll end it in just a minute. I went ahead and ended the poll. Thanks for everyone for participating in that.
All right, and we'll turn it over to our first speaker.
All right, thanks, Rachel. Can everybody see the screen? Good. Okay. I always like to ask just in case. So I'm really excited to be able to join for this particular section of the winter webinar series. I'm the livestock agent in Montgomery County, and my very first call when I started this job was a lambing mortality issue. And so I jumped straight into the job, having to really get to know some of the issues that my sheep and goat producers could face. And I'm excited to share this presentation with you to maybe help prevent some of those issues for other producers. So this first section, we're going to talk about preparing for lambing and kidding and some of the dystocia issues that can arise. So before we get started talking about dystocia or problems with the birth, let's talk about some things we can do to prevent those issues. So prevention is always better than reaction. So starting with a clean, dry, ventilated environment is really important. I really want to point out ventilated but not drafty. That call that I received with the lambing mortality in my county was potentially related to being an open air lambing shed that had, it was a really cold winter last year when the lambs were being born. So it's okay to have some open air, but if they get overly cold, which we'll talk about later on in the presentation, that can create some issues, reduced immune system, susceptibility to disease. But you also don't want it to be so hot that you've got a lot of bacteria growing. So being overly enclosed can also be an issue. I want to make sure you have your adequate bedding and space for lambing or kidding to take place. So all of the healthy environment and healthy lambing kidding starts with preparation. Signs that you need to start doing night checks, or, checking on your ewes and does. Restless, separated from the group, pawing the ground in a nesting-like manner, not eating, and this should only be for about 3 hours prior to birth. If they are not eating and they're in mid-gestation, that can be a really big issue. We want to make sure that we're really supporting those ewes and does in late gestation so that they are well tended and well fed and ready to produce milk for those offspring. There's some birthing vocalizations, and I don't know how to describe this. I wish Johnny Rogers was on here. Maybe I could ask him to do a demo for us. But there is a specific sort of maternal sound that you, as you do this for a while, you'll start to recognize as a potential that birth is imminent. Mucus discharge, softening around the pelvic area, actual contractions. These are all going to be signs that it's about go time for your lamb or kid. And then obviously the water bag, that's when things really start becoming important and timing becomes important. So if you see that water bag, that is your time crunch. So I put the little 30-minute graphic on here. You'll see 30 minutes is sort of key for all of these stages of delivery. So as your kid or lamb is approaching, you should see feet first. So after the water bag has been birthed, if you don't see feet within 30 minutes, there's potentially a problem. Within 30 minutes of seeing feet, you should start to see the rest of the body emerging. So if you're not seeing progression within 30-minute time spans, that's when you may need to intervene. You don't want to disturb that ewe or doe in the midst of birthing, if at all possible. If things can progress naturally, that's the goal, especially with multiples, because sometimes if they birth one and then you jostle them around and get in there and get involved, it can slow the following births. So limited intervention if possible, but sometimes we do have to get in there. The equipment that you should have on hand, whether you're planning on having any kind of dystocia issue or if you're just having a regular birth, the things that you should have would be gloves, antimicrobial soap, halters in case you do have to get in there and get involved with the birth, some drying towels, hair dryers or heat lamps. I really like some of these heat box options. They don't have to be fancy, and you definitely want to make sure that they're in a safe section of your barn. You don't want to have anything that could potentially cause a fire. But these warming stations as sort of an option for those lambs or kids to get warmed up if they're being born in harsh January, February conditions. And then your contacts. Having a veterinarian that you have a relationship with prior to birthing is probably the most important thing that you can have on hand. You do not want to be in the middle of birthing your very first lamb crop and then have to call a veterinarian that doesn't know you, doesn't know your farm. They're much more likely to come and assist you if they've been out before or talk you through it over the phone if they have that relationship. So making sure that that's in place before you start your lambing or kidding season. But even with all of that proper planning and preparation, things happen, especially if you've got maiden ewes or maiden does. The chart on the right is just a couple of examples of ways that, those babies can get into some very interesting positions. And so if they are not in the normal presentation, which would be the feet first, head between the knees, you may have to glove up and do some adjustments to make sure that they are able to exit that birth canal. If they've got a headlock or a leg back, or if you see back feet first, those are all signs that you need to go ahead and get in there and start helping. And in order to be prepared for that, you're going to want to have some equipment on hand again. So in addition to your general equipment, if you have some lube, whether that's the J-Lube or even Vaseline, something that you're able to put onto the glove to be able to get in and help with that birth. And then some optional equipment, the head snare or the leg snare. can help you with pulling. You can do this without that equipment, but that can make it easier for you to be able to position and pull properly so that nothing gets hung up. Some other equipment that's handy to have on hand, thermometers in case you need to get some temperatures on lambs as they're being born, syringes and needles, prolapse retainer and harness, which is photoed over here. That would be if you were having a uterine prolapse, which I'm not going to go into depth on. Hopefully that'll be covered a little later in the presentation. Leg splint and cotton bandages and vet wrap all would be good to have on hand in case you have some standing issues with the lambs, which again could be covered later in the presentation. And then some of your basic medications that you would need instructions from your veterinarian to provide. But these are all things to have on hand in case of pregnancy toxemia, things like that. You definitely don't want to be in a situation where it's cold, it's the middle of the night, stores are closed, and you don't have the things that you need. As we move into postnatal care, there's going to be some information in here for the lambs and kids as well as the ewes and does. So after you've gotten through the birthing process, you've got your lamb or kid on the ground, there's the clip, dip, strip, that handy little it was mnemonic to remember that you should potentially clip the umbilical stump to within 2 inches of the body. That can cause some excess bleeding. So unless that's absolutely necessary, if it's a really long stump, then you may need to do that trimming. But regardless of whether it's long or short, you're definitely going to want to dip with iodine or spray with iodine to prevent infection, and then strip the ewe or doe's teats. So that's just applying pressure to make sure that the milk comes in and the milk is accessible to that baby. You're going to want to monitor for the placenta delivery within 6 hours. Otherwise, that can cause issues for your ewe or doe. Ensure that the lambs and kids are warm and full. And Emily in our next segment is going to go into a lot of detail about why that is super important to keep those babies warm and full. But you want to make sure that they have a warm mouth. They're stretching when they stand up. They feel full. They're so small, you can usually feel if the belly is expanded or not. So making sure you're really doing that check within the first few hours of birth. And then ensuring that your ewes and does have plenty of water and high quality forage. They're about to start making milk for potentially multiples. So they really need to be supported in that lactation stage as their milk is coming in and dropping down and they're making that colostrum. And you're going to want to monitor those udders. Sometimes if there's only one, they may not nurse on alternating sides. They may only nurse one teat and you'll see excess in the other. You can milk that other teat and save that colostrum for later. What you don't want is to let it back up and then create swelling that could turn into mastitis or infection of the udder. Processing the kids. So within 24 to 48 hours of lamb or kid being on the ground, you're going to want to go ahead and get your processing done. And this may seem really early, but the later that you wait, the more traumatic and painful it's going to be for those animals. So the best method is to just go ahead and do all of it while they're small, and it's easy to get it done. So identification tags placed between the veins. You don't want to hit a vein or artery. So placing, just feeling for that hard spot in between. Placing the ear tag and having your record keeping in place. Really important to know which of your ewes and does are producing multiples, which ones had a lot of dystocia issues, because that can lead into your cull decisions down the road. You may not want to keep a doe that is repeatedly having birthing issues. Selenium and vitamin E supplementation, that is going to require that relationship with your veterinarian. So if your veterinarian has identified that you are in an area that is deficient in those minerals, they may suggest that you supplement with an injection within 24 to 48 hours. But you'll need a script to have that done. And then if you choose to dock tails, you're going to want to band about 3 joints down at the base end of the caudal fold and spray with iodine to prevent infection. So there's a little image over there of the tail docking. And to do that, you're going to use an elastrator or bander to wrap the tail, and it would fall off within a week or so, a couple of weeks of being born. Here's some equipment for that lamb processing that you'll want to have on hand. So again, you don't want to be frantically going out and buying all of this right after birth. So iodine, scissors, the scale over here, so you can record that record keeping piece of which lambs or kids were weighing at the highest amounts or lowest amounts. Birth weight's important. And then ear taggers, elastrator, bands and tags, and needles and syringes for injections. Castration, if you are going to castrate, should also take place within 24 to 48 hours for those male animals. Depending on your market, you may choose not to castrate. There are some ethnic markets that you can sell the males intact at a young age and skip this management step. But if you choose to skip this step, you're going to want to separate your males and females by 4 months of age. Otherwise, you'll have some additional issues. You'll want to use that same elastrator that you use for tail docking. And as long as you can count to 2, you should be able to do this yourself. This is not something you'll need your veterinarian to do. You need to make sure that you have both testicles. That's why counting to 2 is always important. You need to make sure they're both in there and wrapped. And again, it's just like the tail docking. They should fall off within a couple of weeks. Spray with iodine, possibly fly spray to prevent any infection. Tube feeding and bottle feeding. Prior to being an extension agent, I worked as a veterinary technician for a large animal vet in Texas. And one of my major job duties was always doing the tube feedings for clients that brought in lambs and kids that were struggling. And this is something that you can really save yourself a lot of money if you're able to do this by yourself. This is not something that a veterinarian has to do. You are perfectly able as a farm manager or producer to do this on your own. It scares people a lot because they're afraid they're going to drown the lamb or kid. But if you practice and follow the steps, you're very likely to be successful. And I always tried to remind clients when I was teaching them to do this as a vet tech, the possibility that that lamb or kid was going to die was very high anyway. So you doing intervention is potentially going to save this animal. You doing nothing pretty much guarantees that they're not going to make it. So it's always worth a try if they're struggling to go ahead and choose the tube option. If it's a situation where you have a healthy lamb or kid, you should always try the bottle first. If they're up and they're not having any medical issues, they're not lethargic, they're not cold, maybe the ewe just doesn't have milk coming in, that's different. You can try the bottle first. But if they're having any sort of medical issue, then you're definitely going to have to move into the tube situation. So Emily is going to talk a lot about the starvation hypothermia complex. That's a situation where you're definitely going to want a tube. So the equipment that you want to have on hand in case that takes place. So if the lamb has not nursed within 4 hours, you have to intervene, you have to do something. So you're going to want to have some syringes, 60 milliliter syringes, an esophageal tube. Potentially, if you wanted to have a milking assistant, a milk machine, you could use that to milk from the doe or ewe, but you can also hand milk and collect the milk. You can have frozen colostrum on hand. There's powdered replacements. So as long as you have some sort of milk colostrum specifically on hand for your tube feeding, you should be good to go. And then the bottles and nipples in case they're able to take the bottle. So what you're going to want to do first is measure the length that the tube needs to be inserted. And to do that, you start at the mouth of the animal and you measure back to about the last rib, which is where the stomach should be. And you roughly measure, okay, I need this to go in let's say 12 inches. So as you're inserting the tube, that is a really good indicator that you have actually hit the stomach and not the lungs, because if you're in the lungs, those are closer. So you wouldn't be able to insert the tube to that full length. And that would be a sign to back up and try again. But if you are actually in the stomach where you're supposed to be, you can insert the tube to that fully pre-measured length. So once you've got that measurement, you've dipped in some clean water, and you elevate the jaw of the lamb or kid. I'm going to go back one slide so you can see that. This is a really good example of the position. And you can see in the photo that you can actually see the trachea and esophagus. Because these animals are so small, you should be able to feel what's taking place. The esophagus is behind the trachea. So you're going to want to aim for the back of the throat, run the tube down so that the animal swallows it. If you see choking and gagging, that's a sign that you're in the trachea, not the esophagus. So they should be swallowing. You advance the tube to the predetermined length. And then the check step is really important. If you have the syringe on the end of that tube and you pull back and it's difficult to pull the plunger, that's a really good sign that you're in the stomach, because those are very friable tissue areas. So that tissue can be sucked into the end of the tube as you're pulling. If you pull back and the plunger is really easy to move, you're probably in the trachea. That's a hard tube. So it's, the air is going to be free flowing in that area. So there's a lot of checks along the way to make sure that you are in the stomach and not in the lungs. Once you're confident, go ahead and remove the plunger, place the colostrum into the tube for a gravity feed. You don't have to push it. You don't have to do anything. You can literally just hold the tube up and it will naturally flow into the stomach. Applying pressure can actually cause the stomach to rupture, so you don't want to press the syringe if at all possible. When using colostrum, a really important point, don't ever microwave it. If you microwave it, you're going to potentially damage the antibodies that you're trying to get into that animal anyway. So you're going to want to put that into a hot water bath to dethaw it. And if at all possible, if you can collect the colostrum directly from the mom, that's the easiest method to get the milk into the newborn. Okay, the importance of colostrum. So that's that passive immunity. Anything that the ewe or doe has been vaccinated against or has developed antibodies against can be passively transmitted into that lamb or kid and will protect that animal as they grow. So colostrum is really important for overall health and development. And the goal is for them to receive 10% of their body weight within 24 hours. Sooner is better, but at least by 24 hours, 10% of their body weight. And again, you can obtain that in many ways, directly from mom or frozen or powdered options, and never put it in the microwave. The math is pretty simple. So, if you had a 10-pound kid, you would use a pound of colostrum, which is equivalent to 16 ounces or 480 milliliters. And you would feed that by either bottle or gravity feed through the tube. So this presentation is almost completely a visual adaptation of Dr. Weaver's fact sheet. So if you have not checked that out on NC State's website, it is a full in-depth guide to beginners lambing and kidding. So you should check that out. I also used Washington State Extension's article on tube feeding, which is where the photos came from for the tubing section. And if anybody has any questions, please feel free to put them in the chat or let us know. Otherwise, I'm going to hand it over to Dr. Cope.
Okay, thanks so much, Tracy. Good evening, everyone. So glad to have everyone join us. It looks like we have a lot of participation from North Carolina, but we're also scattered around the rest of the country and Canada. So welcome everyone this evening. Tracy did a really great job setting the stage for us, talking about those first few hours of lamb management and care. And so we're going to get into a little bit more. And if if you recall, she had mentioned briefly a complex known as the starvation hypothermia complex. And with this, we see this being one of the main causes of mortality in our new lambs and kids. And so what happens is, we'll just think of, well, I'm laughing today because it's been about 38 degrees here in North Carolina today and lots of rain. And so that's going to set the stage for a really great lambing and kidding evening for a lot of people if you're in the middle of lambing and kidding. But newborn kids are unable to regulate their body temperature for about the first 36 hours after birth. So what's great is though that they're born with a special type of fat known as brown fat, and that brown fat helps insulate them for the first few hours. But after those few hours, that brown fat can be metabolized through or burned through rather quickly. So we have to think about what are some other ways that our lambs and kids can generate body heat. So hypothermia happens when there's an excessive body heat loss, and then that's paired with a reduction in heat production. And so our lambs will require, not only body fat, but the colostrum that Tracy talked a lot about, as well as milk. All of this is required by our lambs and kids to have the necessary heat production that they need to sustain. And so with that, we think about there's insufficient energy or metabolism, and hypothermia can occur because of that. And so with that also we have hypoglycemia, so low blood glucose. And now this all can lead to the hypothermia starvation complex. And so real quick, just as a reminder, if maybe it's not a reminder, maybe it's the first time for you, but normal body temperature for our lambs and kids is 102 to 103 degrees Fahrenheit. And so that's normal body temperature. We start to enter into mild to moderate hypothermia when we creep into that 98 to 102 degrees Fahrenheit. And then we enter into severe hypothermia when we get to below 98 degrees Fahrenheit. And so there's really two main ways that this the starvation hypothermia complex is brought about. And so number one is excessive chilling of lambs and kids. And this can be due to environment and management. And so, environmental today here in North Carolina, I said it was 38 degrees and it poured the rain all day. And so with that, of course, I'm going to have some of those mamas that have an option to potentially enter into a lambing or kidding barn, but they're still going to elect to lamb out in the middle of that mud puddle and drop their lambs and kids into mud. And again, that's just, it's not going to likely be a positive thing for those lambs and kids born in that harsh environment. Because again, they're leaving an environment that was about 102, 101 degrees Fahrenheit and coming out into 38 degrees, and that could be cold shock for them. So these lambs and kids can become cold. If they become cold, that will make nursing less desirable, so they'll want to not eat. And so then they become more chilled because they're not taking in necessary nutrients, and then they're no longer nursing at all. And then that health status of that lamb and kid can rapidly decline. And so that is, first, they're cold. They get chilled for one reason or another. And that's one of our main reasons for starvation hypothermia, but then also too, just lack of nursing. So is this an issue of bad mothering? Is this an issue of just being a smaller lamb or kid born in a litter and not having access, not being as aggressive as some of the litter mates? So the lamb and kid stops nursing. So then there's lack of nutrients, which then further chills the lambs.
Well, I'm not too worried about that, but it's like.
And so if the lamb or kid stops nursing, then it becomes even more chilled because those nutrients are not generating heat production within the body. There's no caloric intake. And then still the health status of that lamb or kid rapidly declines even further from there. So those are the two main the primary reasons why we enter into a starvation hypothermia complex. There's they're in tandem with one another most of the time. Let's see. So how do we think about what are some ways that we can prevent this starvation hypothermia complex? And so I mentioned it with a really silly example, but I'm sure that you all have experienced it as small ruminant producers. You've just got that one bad mom, or maybe you got a handful of them, right? Or maybe you have a first-time mom and they're predominantly out in pasture, but they have access to a lambing or kidding barn. And so of course, Murphy's Law will tell us that no, they're not going to go into the lambing barn to lamb out. They're going to lamb out in this nasty weather outside, and they're going to drop those lambs in a mud puddle tonight. So with that, we can still try and provide shelter at lambing. We can shear or crutch the ewes. And so crutching would just be to shear around the udder and around the vulva area for those ewes. Not so much does, maybe if you have an Angora breed, but anyways, you're going to allow easier access for those lambs and kids to find the udder to make nursing easier for them. Use a confinement area or a jug for 24 to 48 hours. It not only promotes bonding, but you'll also be able to kind of assess the dam's milk supply. Do you notice, are her kids and lambs up and are they suckling? Tracy had alluded to this also, or had mentioned that, are they only nursing from one half? So this will help you be more observant as a producer. And so assisting with those small, weak lambs and kids, if they need help finding the udder, those first few hours after birth, or tube feeding can be a really good option, but we'll talk about when not to tube feed. And then adequate colostrum intake. Tracy had mentioned that we want to make sure that there's 10% of lamb body weight in colostrum within the first 24 hours. So if you have a 10-pound lamb, it would need 1 pound or 16 ounces of colostrum in those first 24 hours. And then we'll mention just briefly later, we'll talk about fostering or grafting lambs and kids when necessary. And then don't be afraid to have some hard, fast rules on culling. So go ahead and determine what your culling parameters and your culling criteria will be. And if you've got a mama that's just a really bad really bad mom for whatever reason, bad mothering ability or milk production, go ahead and mark her as a cull if that would, help decrease lamb mortality on your operation. So we talked a lot about the lambs and kids themselves, but we can't forget about the dams. We can't forget about those ewes and does prior to lambing and kidding. We have to make sure that late gestation and early lactation nutrition are adequate. So meaning, are they meeting their nutrient requirements for late stage gestation and early lactation? And this is paramount because remember, thinking about our production cycle, lactation is the highest energy demanding period for our does and our ewes. And so all of their energy reserves and a lot of the nutrients that they're intaking are going to go towards milk production. And so we want to make sure that we're giving them every opportunity to be in an adequate plane of nutrition, maybe even have a little bit in the reserve tank, right? Okay, so we want to avoid energy deficiencies. We want to avoid negative energy balance because those things can contribute greatly to poor milk production and milk quality. We see that with research that dams that are underfed or are receiving a restricted diet or inadequate nutrition, that milk and colostrum quantity and quality are severely diminished. And so we just want to make sure that we're doing everything that we can to set the stage for success. And this will also if our nutrition is hopefully in check, and it doesn't have to be simple, or it doesn't have to be complex, it can be really simple nutrition program, but we want to also avoid ketosis and pregnancy toxemia, because that's going to further contribute to lamb and kid starvation. So if ketosis or pregnancy toxemia, negative energy balance in general are occurring, what could happen is not only is that dam's milk supply going to reduce in quantity and quality, she's going to start breaking down her energy reserves. And from there, then milk production is going to be sacrificed, or she may not have the energy to stand. And if she doesn't have the energy to stand, then those lambs and kids are going to have trouble nursing. So then the domino effect occurs with starvation happening at that point. So intervention and treatment. Healthy kids, we should know, right? Our healthy kids and lambs are content, they stretch with standing, and they wag their tails. That's a happy little lamb, right? If we see those behaviors after standing. So, but a weak lamb, right, or a sick lamb is generally gaunt in appearance. They're weak, they have a hunched appearance, they're listless, sunken in sides. There can be no or poor suckle reflex, so you can check for that. Tracy had mentioned that for determining whether or not to tube feed. And then also a cold mouth. You can just easily check the inside of their mouth and determine, gosh, do I think this lamb is potential for cold stress or at risk for becoming excessively chilled? Check their mouth. Their mouth is cold, then yes, we need to look at some other steps for intervention. And then we can always just pull a rectal temperature on that lamb or kid to determine where are they on our chart. Again, 102 to 103 is a normal body temperature. 98 to 102 or 101 is mild to moderate hypothermia, and then severe hypothermia is going to occur at 98 degrees Fahrenheit and below. So treatment. So with mild to moderate, those 98 to 101 cases, we can feed colostrum via stomach tube. Tracy went over great instructions for providing a tube feeding via stomach tube. So we want to feed the colostrum. Again, we're not going to microwave it, right? These lambs that are mild to moderate that we're going to go ahead and tube feed they have a body temperature greater than 99 degrees, okay? So we're going to monitor for a return to normal temperature. We want to see normal temperature go to 102. And so once body temperature returns to 102, we can go ahead and return those lambs or kids back to their mamas. Now, if it is a severe case of hypothermia and we're below 98 degrees Fahrenheit, we want to use a warming box until normal body temperature returns. We don't want to do anything yet with stomach feeding. Those lambs and kids that are below 98 degrees, we want to make sure that their body temperature is at least 99 degrees before we offer colostrum or milk via tube feeding. And that's because that's going to further chill those lambs or kids if we're going to deliver that colostrum to them below 99 degrees. And so we can monitor again for return to normal body temperature. And then at that point, once normal body temperature is reached, go ahead and return them back to their dams. You can find some really great instructions online for making a warming box, or there are some companies that just a quick Google search, you can, if you're in a season of life that convenience is better and best for you, then purchase a warming box. But then again, they also make some great instructions online for how to do just a homemade DIY project. Okay, so that's going to wrap up our brief 30,000 foot view on starvation hypothermia complex tonight. So we're going to move into pneumonia. Pneumonia is another one of causes of death and early mortality for our newborn lambs and kids. And the main causes of pneumonia can either be bacterial or virus. And a major player in pneumonia can be inadequate intake of colostrum or when passive immunity has waned off. So, but there's also a lot of predisposing factors. Environmental conditions are huge. we want to really avoid damp, crowded, poorly ventilated, excessively dusty environments, and those with a high humidity, okay, as well as stress. But the environment is going to really be a major player in the development of pneumonia, just because you're making a perfect environment for those bacteria and those viruses to thrive in these environmental conditions that I just mentioned. Avoid stressful times if at all possible too. And then again, nutrition. I know we don't always like to do math, but inadequate nutrition of the dam in late gestation and early lactation are huge. So you just got to make sure that the ration that you have formulated, the ration that you're providing to your dams, is meeting their nutrient requirements. Okay, so these favorable conditions of the poor environmental factors will cause a buildup and spread of those bacteria, of the pneumonia causing organisms. And so we want to do as much as we can to make sure that hygiene and sanitation are in part of our management strategies. So clinical signs of pneumonia, we can see increased rate and depth of respiration. We can also see loss of appetite, droopiness, just overall poor doing, a splayed stance. Too can also be a visual indicator of you have pneumonia. And then also we can even see nasal or ocular discharge. So that can range from clear, cloudy, or bloody at varying degrees of nasal discharge. Coughing can also occur, and then a really elevated body temperature. So we're talking about a body temperature over 104 degrees Fahrenheit. And again, normal, even for our mature animals, is 102 to 103 degrees. And so Tracy had mentioned a great toolbox to have for lambing and kidding. Making sure that you have a thermometer in there, even for your mature animals, is super helpful. So prevention with pneumonia, we want to think first too about our environmental conditions. And I told you what were undesirable environmental conditions, but let's talk a little bit about what are desirable environmental conditions. We think of dry, clean bedding. So especially during lambing and kidding, if you're using jugs, how often and frequently are you changing out those jugs, that jug bedding in between lambings and kiddings, offering clean, fresh water. Our small ruminants, especially sheep, can be particularly picky about having dirty, contaminated water. So making sure that they have a good, clean source of water is just highly encouraged regardless. Good ventilation, good herd housing practices. So do not overcrowd, even at feed bunks, right? And so we want to make sure there's adequate space for everybody to gather around that feed bunk. Minimize stress when and where possible. And so this just means like handling, making sure that we're not handling the animals unnecessarily. Tracy talked about good processing of lambs from an early age, but really just doing as minimal as possible and not handling them beyond what is required. A shear use prior to lambing. This would be really big if you have wool breeds of sheep, because this is going to reduce moisture in the barn for you too, which will just help make it a less desirable environment for those pneumonia causing organisms to thrive. So we can do vaccination. I will say consult your veterinarian for best practices with regards to a vaccine protocol for pneumonia. There are Pasteurella vaccines available, but again, consulting your veterinarian, and now's the time to make sure, if you don't already have a veterinary client-patient relationship, go ahead and get that established. But for our breeding ewes, we would do 2 injections 4 to 6 weeks apart, followed by an annual booster 4 to 6 weeks before lambing and kidding. And that's a really good, important window, because that 4 to 6 weeks before lambing or kidding is we're going to have that passive immunity. Okay, that's where they're going to acquire the passive immunity from their dams. But we know that passive immunity, specifically with for Pasteurella here, can wane after about 5 weeks of age. And so that's where a vaccine could come in handy, but speak to your veterinarian about that further. And then lambs, we can vaccinate at 10 days of age or more, but not before. Treatment. So with treatment, control really depends on correcting the predisposing factors. So have you done a critical evaluation of your environment? What do your barns look like? What does your lambing barn look like? Are you overcrowded? Could you improve your ventilation? Could you do open shed lambing instead? So thinking about making sure you have critically evaluated what your management practices are will help determine if you could correct any of these predisposing factors. And then also, we just really want to be prompt in our response time. As soon as we start seeing a poor doing animal, are we taking the intervention steps necessary to prevent further decline in our animals? And then again, there are two types of pneumonia, being viral or bacterial agents that can cause it. So that's why, again, consult your veterinarian for the most effective treatment. An antibiotic may not be necessary, especially if you have a viral agent. So you really have to consult the vets on that one for treatment. Okay, so that was rapid fire also. So we'll end and wrap with me when we talk, or as we talk about fostering lambs and kids, often known or referred to as grafting also. But fostering in its simplest terms involves finding new mothers for lambs and kids that have been orphaned. And an orphan animal can occur via many ways. The ewe or doe death, offspring rejection, so bad moms for whatever reason, or inadequate milk supply. If those dams just don't have enough milk to nurse the number of offspring they have, or even their own offspring. Okay, and so thinking about lamb or ewe and doe nutrition too here can be important. And sometimes they just don't have enough. Like if she has triplets or quads, then her milk supply is likely not going to be adequate. So a few methods of grafting, and I will say, so the success of this fostering in general, the success rate goes up if intervention occurs early. So the earlier you do fostering, the better success rate you have for a dam accepting an alien offspring. Okay, and so we want to make sure that you are aware of that. If you're going to be most times successful with fostering, it's best to provide intervention as early as possible. And again, this is one of those that, if you don't have experience with it, talk to a producer that's been doing this a while. Okay, pair up with someone during lambing and kidding season, see if they've have some foster situations going on, and observe their practices, observe their management strategies for this, because we're going to talk about several here, but not all may work. It's going to kind of be management and individual producer driven too. But so this is not a super in-depth conversation about fostering, just to warn you. But we can do slime grafting, which is where we rub the alien or the orphaned lamb with amniotic or placental membranes from the new mother during parturition. And so that's where we're going to is that ewe or doe is lambing or kidding, we can take amniotic fluid and placental membranes from her and rub it all over the lamb or kid that we want her to accept. And that's got to be done pretty immediately after birth. We can also do another one called scent or stocking grafting, which we can take a large sock or a stocking and we place it on the dam's live or dead lamb at birth. This could have been a dam that had multiples, and we can use the live one, wrap it up in a sock or a stocking, and then after the scent has been acquired on the sock or the stocking, we can transfer that sock stocking to the alien lamb that we want that new mom to accept. And so what happens is that that lamb is able to acquire the natural odor of the ewe's own lamb. So we're going to trick her into her smelling and thinking that new lamb is hers to keep and take care of. Restraint or stanchion grafting This can be really successful too for a lot of producers, depending on your operation, but it's an adoption pen where the ewe's head or doe's head is stanchioned in place. She has access to food and water, so she's able to hydrate and nourish herself. But then we place the alien lamb in the pen with the ewe, and we watch that little alien lamb for signs of nursing, making sure that that lamb is able to adequately find the udder, the teat for nursing. And then after about 3 or 5 days, we can release that new mama's head from the stanchion. And we want to probably keep them in that adoption pen for a couple of more days just to make sure that she's not rejected the lamb after she's been released. And then from there, just go ahead and throw them out into a mixing pen. And then skin grafting. This can be really popular too for a lot of our producers, but skin grafting is where we skin the dead lamb. And we skin it, and then we attach the skin hide to the alien lamb to be grafted onto the new mom. And so it's literally, a sheep in sheep's clothing, right? And so we are skinning the lamb that has died, placing it on a new lamb to be accepted by the mother that had that lamb that died. So again, fostering can be really great if done early. Your success rate will go up exponentially if you're able to do it from an early stage. And so with that, I will end my presentation. If you've got questions, throw them in the chat and we will get to them at the end. Thanks.
Give me 1 second to get the next set of slides loaded. All right, I'm going to transfer it over to Dr. Broadway.
So good evening, everyone. Certainly a pleasure to be with you. And the slides you're going to see are not what I would consider extensive. Actually, when I give presentations, I'm more likely to, a lot of what you'll see is really to prompt me into going into different conversations. So if you've got questions, I'm certainly open to that. My background, just to give you just a little bit about me. I was in private practice doing large animal medicine for nearly 10 years. I've fielded a lot of the small ruminant, particularly, and cattle ruminant calls during that time for the practice I was with. I was also partners in a goat dairy. And so I got to live all this as well as work on it. So it's a little bit of a different type thought process. Currently, I'm the county veterinarian for Union County. I work under the public health department, and I've got more responsibilities than I can keep up with at this point. So it's just another bit of fun. But again, the part I was asked to kind of go over is, when's it time to call the vet? And that is a very, very open-ended question that could go in many different directions. So the health concerns to keep in mind are and dystocia. We've already heard, talked about that at the beginning of this presentation and did a fantastic job. Certainly something you're going to run into. An idea of, what I was always told and what I would tell producers was, you've got 15 to 20 minutes, of manipulation before you're going to start having swelling to occur within that pelvis. And so at that point, I would always just say, hey, if you haven't got it done within 20 minutes, call the vet, because it's going to take us 30 minutes to get to you normally. So just go ahead and have that thought process in mind. A couple of the other areas where you need to get a hold of a vet sooner than later: prolapses, and we'll go into more detail on that. Multiple different types there, as well as mastitis, and that's certainly a big one, whether you're dealing with sheep or goats, and if if it's meat kids or lambs, if they're not milking, if they're not producing, then those kids aren't growing. And you can only feed so much weight on them. You need mom doing her job. So, and then if it's on the dairy end of things, if that udder is not healthy and that doe or that ewe's not producing, then you're not making milk, you're not making cheese, you're not making any of the other items that you're looking for there. And then the last thing I'm going to touch base on is antibiotic usage and regulatory changes. There have been some updates from the federal government, from the Federal the Food and Drug Administration, FDA, oversees antibiotics. And so we'll go into some changes that are happening there and what it means. It's not, there are some folks that seem to think that it's the end of the world, and it's not. It's just a matter of a lot of us being, as producers and veterinarians, being better stewards of what we have. So prolapses, and there's, three of the main, well, there are actually four main types that you will see throughout the different stages in production. The picture here shows some of those pictures, or some of those more common ones. And typically you're going to see prolapses more common during the pregnancy process. And a lot of that is because at different points within the pregnancy, you've got different amounts of stress within the pelvis. The number one item there, the vaginal prolapse, that seems to be what we see more times than not. And if you really think about it, as those kids are getting bigger, it's going to, like I mentioned in the slide, it's going to occur later in the pregnancy. Typically, once those tendons on each side of the tail, or tail head, once they start to kind of release and loosen as we're getting towards the end of the pregnancy, and those ewes or does are laying around, if you think about it, there's not but so much space in that abdomen, and she's got to have all the internal organs that's necessary. Plus, you've got the rumen, and you've got this pregnancy, this uterus that's getting bigger and bigger and taking up more and more space. And so, naturally, as things loosen, it's going to go as it's going to give way in the easiest point. And so sometimes you may see a vaginal prolapse. That's the middle picture there. Where that really runs into a problem is when those ewes or those does start feeling that pressure within their pelvis, then that's what stimulates them to want to push. And so they'll start, adding pressure to that, and it just, makes it swell and get bigger, which ends up being, the problem we run into, and it can stress the ewe, it can stress the doe. Like I said, we're typically one that's later in pregnancy, so we want to remedy that as soon as possible. And we'll go into fixes in some other slides here, but the second one, uterine prolapse, if we're going to see that, it's typically going to be after the kids or lambs have been delivered. And a lot of times, if it's been a difficult delivery, if it's an oversized kid or lamb, if it's a pretty tough dystocia, if there's been a hard pull, I've seen it if the lamb or the kids were coming backwards, back feet first, and it was a hard delivery, and all of a sudden the kid comes out. Well, the ewe doesn't think about it or doesn't realize it, and she continues to push. Well, you can see the uterus come right on out behind it. And I don't want you to think that this is a common occurrence. Keep in mind that 99% of these ewes and does are going to lay down. You're going to walk out in the morning and see lambs and kids, or if you're a more hands-on owner and you've been paying attention to the presentations, you're going to notice the signs of the dams getting closer to their delivery times. But a uterine prolapse we're going to see typically after kidding. And a lot of times, if your vet calls, or if you're calling your vet and they're saying, well, what's hanging out? I always used to ask a common question I would ask my producers is, how far is it hanging down? A vaginal prolapse is going to be just outside of the vulva. A full uterine prolapse, it's going to be hanging down typically to their hocks. I mean, it's a fair amount of tissue there. Occasionally, and we'll see cervical prolapses. That's earlier on in pregnancy. We don't see a lot of that in small ruminants, or I didn't in practice. I saw typically, if I was going to see that, it was more in a cattle situation, but I didn't want to not include it because we do see that. And then occasionally you'll see a rectal prolapse, and if you're looking at the pictures there included, it's the one on the left. And it can occur at any age. Where we see it really more than anything is those lambs that have been tail docked way too short. And you see it a lot in that situation. So if you follow the information that's been presented already and leave the tail length as a normal tail length, then you're not going to see that much issue there. But just those are the big ones to kind of keep in mind as we're working through how to keep them in, what to do. So if this is a uterine prolapse retainer, it's also useful for a vaginal prolapse. And what you'll end up doing, there's two types here that you can see. The one on the left, where the paddle would be inserted into the vulva to help retain everything in, with the kind of the U shape, or the going around the sheep's back end. With the one on the left, you see the holes in the paddle, or in the ends. That's typically used to take a needle. I would always use a 16 gauge needle, stick it through the skin, as like you would see in that one picture, the next picture actually of the animal there, but stick the needle through the skin and I would thread this, my suture material through that. That's used to tie it in place. If you don't tie one of those in place, the one on the left, then the U will push that back out. The other one that you see on the right is just another type of retainer. The clips there that are included, made into that one, are actually used, as you see in the pictures, to clip into the wool, so that you got a little bit of extra hold there. And these are just two options. These aren't the only two options available. These are just two of the more common ones that I have certainly used in practice. So another big idea that we run into, that we deal a lot with, is mastitis. And there's some questions, and as I was kind of working my way through it, and what to say and how to work through this, these were the questions that I always tried to talk to my producers about. First and foremost, what is it? What is mastitis? What are we dealing with here? It's the inflammation of that mammary tissue, or that mammary gland. And it's something that can be what we call subclinical, so you may not notice it, or it may be a raging inflammation that the half of the udder is swollen and hot and hard, with all kinds of fun stuff coming out of the teat, that the ewes and the does are really uncomfortable with. Different, but that's when we talk about mastitis, it's an inflammation of the mammary gland. So when does it occur? Well, honestly, we can have it before they kid. We can have does and ewes that kid with mastitis. And it can certainly happen after the lactation's over. And there are folks that have asked, how in the world does an animal get mastitis, prior to lactation? Well, those fun little boogers called flies that will go and land on manure piles and everything else will also land on the end of that teat. And there have been multiple studies, mostly done in cattle, but on dairies, where flies have transmitted, they have typed the bacteria strains present in the mastitis. And it has been shown that the flies were carrying it through, the bred female, the bred heifer pasture. So the same thing, we've had it in the dairy goats and the sheep as well, where you'd have a young animal, a young doe, young ewe that had never lambed or kidded before, that would come up with mastitis, and one half of the udder would be hot and hard, swollen. And if it wasn't treated and it wasn't taken care of, then they could lose function in that side and actually not be a productive animal going forward. Certainly during lactation, we'll deal with it. And what it boils down to is that as the animal is nursed, be it by the lamb or the kid, or if they're milked, if it's a dairy animal, once the milking process is over, that teat canal doesn't seal immediately. So that's the reason we'll often, if they're nursing their babies, you can't run around there all day dipping the teats on those particular meat animals. But if they're dairy animals and you're milking twice a day, that's the reason we're very adamant on wanting a teat dip afterwards, to kind of help seal that end of that teat and to protect that teat cistern in that canal, to keep bacteria from going up into the udder. So question 3 there, what causes it? Well, let me back up. So after lactation, and we often have folks who will say, well, when I wean my kids or my lambs, you do it cold turkey. You just pull them and the does, the udder swells, the female, gets that signal to quit making milk. And they start and they'll dry off within a couple of weeks. Occasionally, and it's not a common occurrence, so I don't want people to get concerned about that, but occasionally you can have some situations where those females get aggressive with one another, and you have some trauma. Or there could be the fly issue again, or you could have some bacteria, subclinical mastitis that wasn't ever cleared, that once the animal is dry, you just got tissue sitting there that has a chance to kind of proliferate and go from that point. So that's how we can have some animals that actually freshen with a mastitis situation. Number 3 there, what causes it? So there are lots of things can cause mastitis. Anything foreign in that udder will set off a mastitis situation. But typically the biggest things we see is bacteria that cause it. And I just listed the more common ones here. Strep, streptococcus, staph is another one, Pasteurella. You heard the discussions about Pasteurella being a respiratory issue. Well, it also causes mastitis concerns in some of these does and ewes. Coliforms like E. coli. We can also have gangrene type mastitis where the udder gets one half, or it could be both, get cold to the touch, and it sloughs off, or kind of, for lack of a better term, it kind of rots and falls off. Not a pleasant thing to deal with, but something that's not the end of the world. But we can also see mastitises that occur due to physical injury and stress. Now you see those does that are real aggressive ewe within a group that does more so, but that somebody's sitting there eating and they want to eat in the same spot she's in, and they decide to back up and ram them from behind. That trauma to that udder can cause a mastitis, that inflammation response to happen. Animals that get stressed also can do that. So we try to make sure as we're working with these females, that their needs are met nutritionally. You've heard the presentations, and when you're talking about space and ventilation and all these other things, and all of it plays into the stress on the animal, and the lower the stress is, the less likelihood of a potential with mastitis. So is it treatable? Absolutely. Yes. Is it always easy to treat? No. I'm just being very honest with you. But what you'll see when there's multiple ways to treat it, and we'll get into more of the what to treat with in a couple other slides. I don't want to jump too far ahead of myself, but you can, there are varying degrees of success depending on the strain of mastitis, and how things are kind of managed. One thing we try to talk about, with some of the staffs and the Pasteurella, let's just say these are milking animals, be it ewes or does, you want to be a little more cognizant of this, because if you're on a milking machine and you strip that animal, and let's say she's got a subclinical mastitis, you could potentially spread it from female to female. So something just be have in the back of your mind with that. Are there consequences? Yes, possibly short term would be decreased milk production. Issue we could run into. Long term, we could have scar tissue that forms in that mammary gland, to where we would have lack of production going forward. I've got a doe right now in my own herd that had got mastitis in half of her udder as a dry yearling. She had never freshened. Me being a veterinarian, I should have caught it, and I didn't. And so half of her udder is non-functioning, but the other half, she functions, actually compensates. Not that that's the situation all the time, but it's something that, when you look at her, she's kind of got a lopsided udder, and those are, just a long-term consequence of that inflammation, that mastitis. So how can you test for it? What can you do on farm that without necessarily having to call the vet out? And the big goal here is to make sure that you understand some of the processes that are available. The California mastitis, you can buy this test kit and do it yourself. You see the paddle there in both pictures. And what you would do in this is you would put the reagent, or you would get a little bit of a milk sample from each quarter, and then you would put that reagent in it, swirl the plate around, and if there are somatic cells, increased inflammation cells in that sample, then you see it starts to clump, and it starts to allow you to see that reaction there, a positive reaction. If it just turns, as in these other slides or other plates here on the right, that one on the left would be more of a concern to me. The other three, where you've got the sample and you've got the it's just a little bit purple, but no, everything's kind of same across the plate itself, the well. then that wouldn't concern me as far as being a mastitis issue. So treatments, and there are multiple types of treatments depending on what's going on. A lot of times the product on the left, and I'm not advocating one product over another. I'm just giving you some options of some pictures. Actually, I pulled these pictures off the internet, but these are things that are available for treatment use. The one on the left tomorrow is actually typically a dry cow treatment. There is a product called Today that's a penicillin based cephalosporin based product there. Same thing with Spectromast. It's a little bit of a different drug. Both are you would put one tube per half of the udder and to treat it. Typically what I would recommend in that is the animal would be milked out totally, everything you can get out. And sometimes you're going to get chunks. Sometimes you're going to get bloody looking milk. Sometimes you're going to get just real watery milk, real thin milk. Milk the half out completely, infuse this. And if you look at the tube on the left side and at the tomorrow box, you'll see the tube there, the very tip of that, the red part twist off. And so you would actually, after you've milked that half of the udder out, you would clean the end of the teat, ideally with like an alcohol swab or something, an antiseptic, and then insert that into the end of the teat, push the plunger on the tube, and then massage that into the udder, into that half of the udder. We typically recommend doing that. I always had my clients do that, twice a day for a minimum of 3 days, and then, kind of regroup and let's see how we're doing treatment wise. The other, this is treating locally. So this is treating in the mammary gland itself. It's going to stay in the mammary gland. It's not going to go across the whole system of the animal. The other things that sometimes we'll do, depending on the bacteria present and what's going on, you can treat, both with intramammary infusions like these, but also systemically with a broad spectrum, antibiotic, like a LA200 or, others there that, in every situation is going to be a little different. But the other odd thing that we normally will include is Banamine, Flunixin, and a lot of times, and that's an anti-inflammatory, just to help kind of calm down that situation in the udder. It works very good in soft tissue. So, and just have that conversation with your veterinarian. Everybody does things a little bit differently. So we just want to, I'm not saying this is the end all. I'm just giving you some options here. So the last topic that I was asked to kind of touch base on are the antibiotic usage and the regulatory changes that we have, coming forward. And you may be aware of it, have heard. And so let's just go through a few considerations when we're talking about antibiotic usage. First and foremost is how are you going to administer it? Are you going to give it intramammary, as we've seen with the mastitis issues? Are you going to give it sub-Q or subcutaneously, which is just under the skin? Or is it going to go intramuscularly? And that's going to depend on the product and the dosage quantity. And also something, like I said, a conversation to have with your veterinarian, not that, there's not that all the answers are simple, but there are answers. It's also going to depend on the considerations as to the class of drug you're looking at. Or is it an antibiotic? Is it an NSAID is a non-steroidal anti-inflammatory drug? So that's going to be the equivalent of Tylenol or ibuprofen that we would take. That was the class of drugs that we use for inflammations, for if they're running a fever, if they're those kind of things, we would consider that before giving an NSAID, before giving Banamine or anything like that. Certainly talk to your veterinarian. If you're going to have the vet come out and you give it Banamine and don't say anything to the vet about giving it, let's just say that I'm coming to see you and I get there and you say the animal has been running a fever and is feeling bad and you don't tell me that you gave it Banamine, that can mask some of the symptoms that we would see. So, if the animal's in bad condition or, hurting, that kind of thing, it's not that we don't want you to treat, but just let us know, let your vet know. That way we know to expect, what may be, masked that we may not be seeing. Withdrawal times, always things to think through. If this is a meat animal, how long is that going to be? Withdrawal time going to be? Is this a dairy animal? How long do you need to withhold the milk? before it's used for whatever process you're using it for. We're going to talk about number of treatments. A lot of folks, I've heard many times, I gave it a good dose of penicillin. Okay. Did you give it 1 dose? Did you give it 2 doses? Did you use the labeled instructions on the bottle? And there's a lot of, so those are conversations, to have with your veterinarian. Penicillin, typically, if it's not given twice a day, it's not going to be effective. If you give it at the dose listed on the bottle, it's not going to be effective. So those are situations where we want to make sure that you're educated and that you have the information you need going into it to treat the animal and be able to do so with confidence, on the farm. The veterinary client-patient relationship, or VCPR, that's a big word you see a lot these days. And really, if you want to boil that down to brass tacks, that is just the fact of me having a relationship with my clients, you having a relationship with your veterinarian, to where we understand what's going on your particular farm and how you move forward. Everybody does things differently. No herd is managed the same. And so having that relationship, allows us to walk into a situation and be better prepared. It also gives us a chance. And, I know in a lot of areas of the country, and I've seen where we've got a lot of folks across the country and the continent here, and that's fantastic. A lot of areas are seeing shortages in veterinarians. And so if you don't have that relationship, you may not get seen. Not a great thing to think about, but it's a reality. And so having that relationship will ensure that you have access to what you need and you can get the help that you need. So let's get into these regulatory changes that we've heard about and talked about and gone back and forth. So back in 2017, 2018, the Pew report came out when and FDA utilized that and some other information, some other data to preserve antibiotics that are useful within the human population. And I'm really making this, I'm trying to simplify this as best I can. But at that time, they made all antibiotics that were used in feed and or water. They had to be under a veterinary prescription, or a veterinary feed directive is what it was called at the time. At that point, they allowed over-the-counter antibiotics like your LA200s, like your penicillins, the things like that you could buy at Tractor Supply or your local farm's feed store, that kind of thing. Those were still, left out and left available. That loophole was there. But the understanding or the goal at that point that FDA had was that at a point in the future, those would also go under veterinary prescription only. And so the rules had come out finally, and as of June of 2023, next June, all antibiotics, will be available by veterinary prescription, only at that point. So is it time to go stock up and buy everything at the local feed store? Absolutely not. Are you going to be able to get the antibiotics you need when you need them? Absolutely. But you're going to have to do some forward thinking and some planning and have that veterinary client relationship that we've mentioned. So this is only what FDA is doing is they are suggesting and or recommending that companies that make I was reading my slide here, that make antibiotics, that they change their label to say, available by veterinary prescription only. So when FDA makes a recommendation, do you think that most of the companies are not going to follow through? Absolutely not. This is going to happen. This is how it's moving forward. What this does not impact, and I want to make sure we try to make sure everybody understands this, vaccines. It was mentioned earlier, being on a good vaccine program, for the health of the animals, those are not impacted by this. You will still be able to get your vaccines without any issues. There doesn't have to be a prescription for a vaccine. Dewormers, the fun we all have with small ruminants and the parasite issues, that is not going to be a prescription product. Supplements, and by that we're talking some of the nutritional supplements. Those aren't going to be prescription products. At least is from what we're being told. And so don't think that you're not going to have access to what you need. What this boils down to, and the recommendation that I've been making to producers and certainly in my role now, is to, in the spring, invite or before you're going to go run into a problem. Let's just say, for example, you've been having problems with foot rot in the summer. And so before you get to summer, let's just say in January or February, go ahead and make an appointment and have your veterinarian come out, talk about your herd health, talk about what issues you typically have, talk about what you've seen, talk about how you've treated them. And then, and then that'll give you and the veterinarian a chance to talk through what's needed, what would be required. They can give you some pointers or some ideas to work around having to use antibiotics. But it'll also give you the opportunity to where whatever scripted products that you may need, you can go ahead and have that cleared with the veterinarian and already have them on hand. So that when you get to that point in time where you've got a respiratory outbreak, or you've got a foot rot issue going on, or you've got whatever issue you're dealing with, you're not scrambling to find antibiotics. You're not scrambling to find what you need. You already have a plan in place. And so what this boils down to, like I said, the change is moving forward. It really puts the burden on the veterinarian to ensure that their clients and that the livestock producers understand, really the usages of the antibiotics, and to make sure that we're actually being good stewards of what we have. And so that's it. That was the last one. So I'll certainly, and there's been a lot of information shared. I'm certainly willing, as the other speakers have said, to answer whatever questions I can, and be more than happy to. So I'm going to give this back to Rachel and hope that I don't disconnect anything inappropriately here.
All right. Thank you to all of our speakers. Really appreciate y'all taking the time to speak with us tonight. So at this time, we're going to go ahead and open it up to questions. If you want to throw any questions that you've got in the chat box for any of our speakers, and we'll take the time to answer those.
Also, feel free, if you have any questions and want to unmute yourself and ask them that way, you can do that.
We can go ahead and relaunch that poll. So we're going to put back up those questions that we started with. And hopefully after listening to our speakers, you have a better idea of how to answer all of these. So just take a moment to plug in your answers. And again, if you've got any questions, feel free to plug those in the chat box.
I've got a question about the mastitis. Is the Vimco mastitis vaccine, would that be an effective means of kind of prevention or control for mastitis, or is the research just not there yet as far as how effective that would be?
Say that name again, please.
The mastitis vaccine, I think the brand name is Vimco. I think it's a newer product.
I'm not as familiar with that. I would say from what I've seen, the mastitis vaccine, like where we saw a positive influence was like on the E. coli vaccines. The others, I'm not sure there's not enough personally. I'm not sure there's not enough information to really make me recommend that to my clients.
Okay. Thank you.
So yes, I see some people asking. We are going to be posting the recording of this for you to watch again later if you so choose to. We do have a question about lambing jug size and ideal setup. Emily, do you want to take that one?
Sure. I was actually punting that one to Dr. Weaver too, but we can tag team it a little bit. I think ideal setup, I think that's also producer dependent and what your operation looks like, but it's about size. It's about size. It's about making sure that the dam that's in the jug has access to food and water. So size being 4x4 or 5x5, 4x4 being kind of the minimum space requirements, but then also too, your setup, is it something that can be easily cleaned and changed out in between lambings and kittings, or what is that going to look like for you as a producer? And I'll let Dr. Weaver add anything else that he wants to chime in on that.
Yeah, I hate to say it, like the classic extension response, it depends. But it kind of does, I mean, on your individual production system in your barn, are the animals, how big is your barn? Is it a lean-to? Is it an enclosed space? I think, like Dr. Cope alluded to, I mean, make it as labor efficient and as beneficial for the animal's health as possible. Think about, where are they going to actually have the lambs or kids? How are you going to get them from that location to the jug? And then when they leave the jug, how are you going to get them, those pairs, into some sort of mixing and grouping pen as easily as possible? So, obviously don't have them drop in a pasture 100 yards away from where your barn is that you want to put all your jugs. But it may work. I've seen systems that are very effective where the ewes are housed in a small pasture lot near the barn, and it's easy to just bring them down into the barn, put them there. I've seen systems where everyone's, the entire flock is brought into a barn space or a dry lot area. Everyone has their lambs, and then after everyone's done lambing, they're released back out to pasture. There's also systems out there that are entirely pasture based. So it really depends. And just think about how you keep the flow going through the barn smoothly and efficiently, so that you're not chasing ewes and lambs around too much, because we don't want to cause too much stress, obviously, during that time period. So if you've got specific questions, or maybe you have a setup that you're wondering about, feel free to shoot any one of us an email, and we can maybe address some of those things on a more one-on-one basis. So I was just reading the comment in the chat. I think with anything, we just need to be judicious in our use of it, whether it be antibiotics or dewormers, coccidiostats. Use them when they're needed. Use them when they're going to be most effective. Work with your veterinarian to decide and help determine when those time periods are, and use them strategically. Use them when they need to be used. Obviously, we want to help our animals that are sick when they need it, but then if they don't need it, we want to reserve the efficacy of those treatments. And so certainly guided and strategic use is best. And that veterinary client patient relationship, I think, is the best opportunity to promote that. And if anyone else has any comments on that, welcome to add those.
I do see there's a question. Someone's asking about a genetic link to prolapses. I'm going to let Dr. Broadway handle that one.
So I've not seen any literature that there's any proof to that. There is some anecdotal, kind of thoughts that if a female has had an issue with a prolapse, that her progeny may be a little more prone to that. Truthfully, if that's a concern you have, then call the line and not worry about it. But I've not, to my knowledge, there's not a documented link, to that. So this, I just see the question from about the county vet for Orange County. Honestly, this is kind of a new process we're working through. A lot of the counties, this may be something that some of the other counties across the state look at going forward. Union County just sort of decided to take the leap in and have a veterinarian on staff to where my roles go everywhere from public health to working with the sheriff's office and law enforcement and animal control to working with Rachel here doing extension work and being a resource for the producers. So to my knowledge, there is not a county vet in Orange County, but certainly feel free to encourage your county leadership to think about it.
I will add to that, though, if you are in Orange County and you do need a large animal veterinarian recommendation, check with your cooperative extension office. They may maintain a record of just regional large animal vets. Again, we're not advocating for one vet or over another, but just providing a resource that we've acquired of local large animal veterinarians in that area. So your cooperative extension office may have that.
Looks like we have a question about books to read ahead of first lambing.
I always reference the sheep production handbook. It's got pretty much anything you need sheep related. Has anyone else had experiences with other good resources? Tracy's holding it up there. I'll put a link in the chat where you can find it. And you can get it digitally now on a USB for like $20. So
it is definitely not a light read, but it's super informative. I definitely keep it right next to my desk.
All right, if we have no other questions, I think we're going to wrap it up for the evening. Again, thank you to all of our speakers. Do we have any announcements we need to make before we wrap up?
Don't forget to sign up for our next webinar, mid-January, third Thursday of January, whatever day that is.
I think it's the 19th.
The 19th.
All of the recordings are on the same website, right? That link should take them to all of the recordings.
Yes, all the recordings will be there, and the sign up for a link to the signups for the next webinars are there as well. So,
Perfect.
And that one will be on weaning management and post weaning management. So hopefully, this webinar got the lambs and the kids on the ground successfully, and the next one will tackle what to do next. Thanks, everybody. We'll see you in January.